I taught a class on built environment and health here at the campus for about 10 years. Had many wonderful guests. Ryan Snyder came to one of the classes. Brendan Sullivan was in one of the classes, and one of the maybe the third or fourth class. One was on schools, one was on safe routes to schools, etc. But one is transportation is health policy, and it's a 3-hour class. And I thought, how am I going to fill up a 3-hour class? Well, turned out I could have had 3 classes on why transportation is health policy. And so we're going to do this, and I'm going to do it in 8 minutes, just as all the other speakers are going to try and knock it off in 8 minutes, and I will do the introduction as well. You may have seen this picture in the paper this morning of the 3 senior leaders of intelligence, CIA, and FBI explaining that we are looking at a series of very serious threats. They were accused of naivete, because you can imagine you could end up being the head of CIA and being a naive person. But this is the report that they put out, and I'm going to recommend it to you because it's totally terrifying. And it's just shocking when the government speaks with total bluntness about these are the things that we should be concerned about. And as I was reading it yesterday, it felt unnervingly close to me because of the past jobs I've held. Cyber threats, maybe it's alphabetical, they put that early on, but every hospital system, every transportation system, every dam, every electrical system has to worry about the harm that can be done with people messing around with those systems. Influence on our elections. Weapons of mass terrorism. So I was saying to colleagues outside, the hardest part of my job when I came back from CDC was that I arrived with CDC was giving California $250 million to disperse to preparation for terrorism. And you think getting a bunch of money would make life easy, but it turned into huge battles trying to hire people and then getting beaten up because I didn't hire enough people, and on and on and on. But it also reminded me of my CDC job. I had worked in California for about 15 years, and I thought I was pretty good about being in front of hearings and testimony and assembly and the Senate and all this sort of thing, and I knew a lot about parts per million and parts per billion and toxic substances. I get to CDC, and there's a funny picture here. Frank, I once had red hair. CDC turned it gray. And I got there, and I knew we had the birth defects monitoring program, the cancer epidemiology program, the childhood lead poisoning program, sort of an asthma program, a number of other programs, but I didn't know that we also oversaw the cruise ships that docked in the United States. We were doing dose reconstruction on all the nuclear tests that were done by the United States, both in the South Pacific, and the destruction of chemical weapons, by the way. There was enough chemical weapons to kill every mammal on the face of the earth in Anniston, Alabama alone, Dr. Satcher's hometown. And so overseeing the destruction of these very dangerous things was amazing. And the job was quite intense. In fact, it was so intense that I gained 20 pounds the first 2 years because I had left Berkeley where I could run every day. In Atlanta, you can't even go for a walk because they never invented sidewalks before I got there. But also while I was there were a number of episodes. One was MBTE. Anybody from Santa Monica here that knows about MBTE? And it makes the water taste bad if it was an oxygenate put in gasoline. And we were dealing with this whole phase out of MBTE that was getting into groundwater everywhere. I ended up having to go to the White House all the time because Vice President Gore was charged with this. And a guy named Bob was the head of the whole science activity there, and he was obsessed with climate change. And I really hadn't thought much about climate change while I was there, before I got to CDC. And every day, the overwhelming challenge of what will happen if the sea levels go, and they have gone up about a foot in my lifetime and go up another 3 feet. You imagine what happens to Florida. The issues of much more energy and violence and moisture in the atmosphere. And I gained another 10 pounds. Now, it was really, it was a recipe for depression, to be in a place where you're stressed all the time and you can't exercise. And then I'd go to the meeting, and the head of the National Center for Health Statistics and the chronic people put up the first two maps. This is obesity in 94 and 2000. And there's a message with this, which is, when you look at what's going on now, realize that you're looking at One point on the arc of the arrow, and there may be a whole lot more coming to follow, whether it's climate or something else. Look at the obesity map for 2015. By the way, the average American adult is now not overweight, he's obese. So we have really tracked along, about a pound a year for the last 25 years. And of course, as my weight goes up, my risk of developing diabetes goes up as well. And we now spend about 2 to 3% of the GDP of the United States on diabetes alone. And what do you tell people with diabetes? Eat smarter and exercise more, which is a theme for our why transportation policy is health policy. One of the other things the CDC does is we do this snapshot of the health of the American people, and here's a comparison of people in their 50s. It's a very robust sample. It's called NHANES. It doesn't matter. From 20 years ago and now, do you think excellent health went up or down over the last 20 years? Big time. Limitations of life function, big increase. Do you need a wheelchair or a cane? That's a huge increase. These people are only in their 50s. And you know the next slide, which is that obesity went up and smoking went down. But I didn't know, and none of us knew, this next slide. We physicians have been wagging our fingers at people for 30 years saying, you gotta walk, you gotta exercise, you ought to get on a bike, you ought to go to the gym. Want to see how good a job we did? This is people in their 50s. No regular physical activity. More than half the adults, these are people in their 50s, aren't getting any regular physical activity. And where I'm going with this, and this is why for me transportation really matters, because is that active transportation is the best way, the incidental exercise of walking to work, walking to the bus, going about your physical activity. By the way, thank you Medical Center for supporting this, but I really want you to support a bike route between the two hospitals. Let's keep lobbying very hard, because it's something the residents, the interns, the nurses, the patients' families, and many other people need. And by the way, you can get there in 24 minutes by bike, and it takes sometimes an hour on Wilshire Boulevard. I'm older than you, Monty, but when I was in my pediatric training, I never saw a child with type 2 diabetes, adult onset diabetes. It is now half the kids in the diabetes clinic. Half the kids. And they got diseases, 17-year-olds with diseases of 70-year-olds. I'm not making this up. The data is really powerful. Think about the cost of that. And again, it's bad diet, but yes, it's also lack of physical activity, because we have engineered physical activity out of our lives. So I gave you that rap about all the stuff on my plate and going to Washington and all this, but it hit me one day that nobody in the South cared. In fact, nobody cared at all about a lot of this. And I was driving to work along Wilshire Boulevard, and I see an elderly woman walking along next to the 7-lane road on a 95-degree day, homes of the poor on both sides. And I thought to myself, if she collapses and dies of heat stroke, the cause of death will be, of course, heat stroke, and it won't be absence of trees, poor air quality from all the fossil fuels we're burning, no public transportation. If she's killed by a truck going by, the cause of death will be motor vehicle trauma, and it will not be lack of public transportation. Transportation is a health issue. And so I came back, and I'm not making this up, I called my friend Howie Frumkin, and I said, we environmental health people are worried about stuff that's very far away, remote from people's lives, and what people really care about is where their children live, where their elderly parents live, where they live, the quality of their own lives. And unless we frame this in terms of what people need to make them happy, it's not going to happen. We took the best farmland in the world and put it under houses, and then we tell people you ought to eat good, local, high-quality food. And by the way, I want to commend the Healthy Campus effort and Jane Semmel for the efforts to put the campus garden here and the wonderful work they've done. And we've removed 60,000 square miles of photosynthesis. About 14% of all the CO2 increase on planet Earth is due to removal of trees. And, 6% of all the CO2 increase on planet Earth is from concrete. It's really amazing, because you have to bake limestone at very high temperatures, and then it gives off CO2 when it goes. And a lot of our air pollution problems, respiratory diseases, are related to air pollution as well. And cleaning up the air makes people healthier. Creating environments where it's easier for people to use transit makes them healthier. So this is my last slide. It's totally unbearable, but it is the coolest slide in the whole world. You can get this for free from the Lawrence Livermore Lab. It's basically 28% of all of our energy in the United States goes to transportation. So that's inescapable, and anything we can do to turn that down or tune that down is going to help. So with that, let me jump to and do some very quick introductions, and I'm going to beg the indulgence of my colleagues and introduce all three of you at once, and then maybe you could turn to the next person so we don't interrupt. But please applaud for them when they're done. Matthew Davis, and there's a nice profile in the handout, is, he went to school across the street. He went to medical school here at UCLA. He did his public health degree at Harvard. He worked in the Alameda County Health Department for quite a while. I'm sure he worked with Tony Iton, who has been such an important leader on all of this, and he's very interested in promoting equity as we go forward. So, Montu, you'll be speaking first. Following him is the absolutely terrific Juan Matute, who I met when I first started teaching, and I was just getting him in to work for me, because by that I mean teach for me, because the students loved him, and he could articulate why transportation is so important, and he's the deputy director of the UCLA Institute of Transportation. He's somebody that's really thought a lot about the scooters, the bikes. He did a wonderful symposium at Lake Arrowhead about these things and came very highly recommended. And he's a new dad, so he has to talk fast because he's got to go home and babysit. And then Salita Reynolds, and the last time I was with Salita, don't tell anybody, don't tell my wife. We were in Bogota, Colombia together, in a very private meeting with 2,000 other people in a great big theater, and the mayor was there, and everybody in the whole world's talking about why walking is so important, and I'm there 20 feet from the mayor, and with my black backpack, with my keys, my passport, my sunglasses, and my computer, and waiting for the mayor to finish. It's South America. Waiting for the mayor to finish. Waiting for the mayor to finish. Well, I'm an old man, so after about an hour and 15 minutes, he stops and I find him run to the restroom, come back, and my black bag's still there, and I'm all set to talk when I discover it had been swapped out and it had all been stolen. Well, I got to know the police departments in Bogota, which is, you don't want to go to the Bogota police station, I'm telling you. And so, you had more fun, Salita, there. She is the general manager of the Los Angeles Department of Transportation. You can read the rest of it, but she has been such a breath of fresh air in the transportation world and really a force of nature. And so we kept the force of nature until last. So with that, let's welcome Dr. Davis.